Hey everyone, my name is Shiv Gaglani. I'm the co-founder and CEO of Osmosis, and we've had a couple changes to the panel, as I mentioned. We had twice as many panelists, but true to form, many of them are flattening the curve right now, and they're socially distanced at home and chose not to come to ASU+GSV. But we have more time with these panelists, and so I'm going to go through and have everyone introduce themselves, and it should be an open discussion. Obviously, there are a lot of concepts here that are things that we've all been hearing about for the past 18 months, and I think can be very relatable. And if you have questions, we would encourage that. And actually, as a bonus for asking questions, we have these caffeine mugs promoting good information, accurate, reliable information. So if you ask a question, that's we'll give you a mug too, depending on if we have enough. So with that, let me pass it first to Michael, who will do his introduction and then go down the panel.
Hello, good afternoon. My name is Michael Fu. I'm the National Director of Behavioral Health at Hazel Health. And just a quick background, Hazel, we provide pediatric telemedicine through school systems, so we're seeing children in the school system as well as at home. So as you can imagine, we were really well positioned during COVID to understand what the on-the-ground experience was like. Personal background, I'm a physician by training. My experience is in mostly adolescent health and community health. During COVID though, I've been non-clinical, so I've been mostly focused on the operational aspects, but working closely with our CMOs. Also very in tune with the mental health side of things. That's what I lead at Hazel, and happy to talk about that if it's pertinent at this panel as well. Thank you.
Awesome. Hi, everyone. My name is Ariel Altman, and I am a part of our partnerships team at YouTube, specifically focused on health. And really, we are a newer team within YouTube, and our goal is to empower our users to live their healthiest lives through knowledge, belonging, and inspiration. And really what that means at a very high level is how are we making public health public? And truly public for everyone who comes to our platform, whether they're in New York or whether they're in rural India. So we'll talk a little bit about some of the things we've been doing to flatten the curve, mental health, lots of exciting things going on.
Awesome. Nice to meet everyone. My name is Rishi. Desai. I'm the Chief Medical Officer at Osmosis. And by way of background, I'm a pediatrician, specialized in infectious diseases, spent a couple years at the CDC, and worked on virus outbreak research and did vaccine research. And then have joined Osmosis to help with video production. So day to day, a lot of what I do is help put out really good content and accurate content on topics in medicine and health.
Great, and so the first thing I wanted to share about this panel, some of you were at the previous panel, which was on raising the line and actually training new healthcare workers, ranging from contact tracers to physicians to improve the healthcare capacity. The other part of this is flattening the curve, as we know. And the whole concept is the fewer people who have COVID, the fewer ICU doctors we need. But that doesn't just apply to COVID, that also applies to any other type of health condition. You know, the fewer people who have diabetes, the fewer endocrinologists we need. And really, so there's two sides to this equation, and the work that these three are doing is helpful not only to training clinicians in cases, but for example, Michael's work is how do we get information and healthcare to children in K-12. And so the first question I wanted to ask is, what are some of the things that your organizations are doing to combat this public health threat of misinformation? Obviously with regards to COVID, but there's obviously misinformation with other health conditions. And even before anybody knew what a coronavirus was, there's a whole anti-vax movement that's been around for a couple of decades now. So if we could go down and if comfortable sharing, what are some of the things your organization has done to combat this public health threat?
Yeah, I can start. So there's some basic things that we try to achieve because we are a healthcare organization providing services in school systems. I think a really important word to follow is just consistency, right? So for us, we bring the CDC's recommendations, we bring AAP's recommendations to school systems, but we also have to listen to school systems. It was actually quite impressive. During COVID at the beginning, it was really confusing. There were so many different messages. Schools are trying to struggle with building their own policies. We were over here trying to figure out how do we help schools, what part of the process can we help in, and actually going in and being consistent and reinforcing the policies that they were actually putting out for parents. So for instance, do I need to stay home if I'm symptomatic? If I'm isolated, can I test out of that? Does a PCR test work or does a rapid test work? You put families through a bunch of procedures, and it really sucks when at the end of the day they've done what they needed to do, but they still can't get the result they want, which is, I have a negative test, why can't I come back to school? So for us as healthcare practitioners, we did a lot of work getting our medical doctors or nurses or PAs to actually meet with the schools themselves and discuss what are the policies that you guys are all reinforcing, what do you need extra help with from us to understand maybe a little bit better the medical side of things, and how can we reinforce that in our own workflows, so that when we saw a kid before school, when we saw a kid after school, when we saw a kid to clear them, we were all aligned with the district. This took a lot of the burdens off of the schools, because nurses are swamped, they're burnt out. These are really heavy decisions to make, and we found that a lot of the more severe cases were coming to us, a lot more confusing ones. So that's one thing. The other thing is doing little things like, how do we actually provide additional information, kind of like this mug, right? In a less jargony way, because medical providers, we're trained to be very jargony. So how do we actually reinforce the messages out there, whether they're webinars, whether they're our case managers calling to check in on parents, little things like that matter as well. And then I can talk about this later, but we did a bunch of other initiatives to try to figure out, can we support in screening, can we support in testing, but I'll save that for later.
Awesome. And while acknowledging the fact that misinformation is a huge, huge threat to all of us, it's also important to acknowledge that there's a massive good engine of providing good information to the world. But also on the flip side, there's really one word that we use a lot at YouTube to describe our efforts about misinformation, and it really comes down to responsibility. And what we mean by that is we have a 4 R's framework that I'll dive into a little bit. So the first R of this responsibility concept is what we call remove. So we have policies in place to remove violative content that goes against things like misinformation related to COVID, misinformation related to the COVID vaccine. And in fact, since February 2020, we've taken down over 1 million videos and continue to do so regularly to basically remove the bad videos. Now, there's also a second R, which is reduce. So how do we reduce borderline content that could be seen as harmful? The third R is what we call raise. So how do we raise up really great information from really trusted sources? And even taking into account local health authorities or trusted hospital systems and healthcare systems, how do we also bring the worlds of public health and pop culture together? So raising those types of conversations where we're bringing in experts and having them talk to some of our amazing creators and actually helping their users get the facts. And then lastly is this idea of rewarding really great content as well. So how are we helping local health authorities or even these creator expert collaborations get as much exposure as possible to really drown out the bad and raise up the good?
And so one of the things, with regards to your question about what we're doing is to try, in some ways, a two-pronged approach. Like one is to go directly to the individuals that want to hear about these topics. And the honest truth is that most folks, it was mentioned on the last panel, don't have a background that's sufficient to understand the data. Even that word data is off-putting to a lot of people. And so how do we break it down in a way that's easy to digest and consumable and make sense in their lives? So we do that with our videos, we do that with social media. And so that's the first thing. That's just going directly to the person saying, here's that information you wanted. And also doing it in a way that's empathetic and saying, look, we're not gonna harass or out or be negative or pejorative towards folks that are maybe not comfortable with the idea of vaccinating their kids. We're gonna do it from a place of empathy and compassion and say, look, I understand that maybe you don't think vaccination makes sense for you. Consider this. And it's just kind of leaving it as food for thought. So that's the first thing. The second thing is also empowering other folks. A lot of people are going to believe not necessarily a social media platform, but maybe they would believe their teacher, their pastor, people in their lives. And so allowing those folks to then forward something and say, like, here's something that I watched, check it out. And so trying to empower those folks with little, nuggets of information that they can easily kind of pass along to help convince folks to eventually, hopefully, do the right thing.
Yeah, that's really fascinating. And one issue I think that's contributed a lot to misinformation and mistrust in science and institutions is the fact that we just don't know. I mean, you remember there was a period of time from March to July where, a lot of guidance was put out, then removed, almost on like a weekly basis. And clearly that was, that that kind of hurt, I think, the credibility of some of the science. But it's also just the facts that medical information, public health information, relative to other types of information or other education is dynamic. Things do change, and that's one of the challenges, but also opportunities for the work that you all are doing. So there are two models for how to determine truth. So obviously some organizations like Wikipedia believe in trusting the wisdom of the crowd, right? The law of large numbers, you get enough people commenting and crowdsourcing information, and you're going to find the truth eventually. And then at the fringes, there's going to be obviously some theories that may actually gain some steam, as we've seen in recent months especially. The other is to just trust in institutions, the CDC, the WHO, Mayo Clinic, Johns Hopkins. All the data that we were looking at was from Johns Hopkins on a daily basis. Which of these approaches do you think is going to gain the most steam over the next decade? Are we beyond trust institutions and just trusting the wisdom of the crowd, or vice versa? Are we going to return to trusting the Faucis and the WHO and other organizations like that?
I can jump in here. Yeah, I don't think it's one or the other. I actually think it's an and I think that there's a really healthy interplay between both of those two forces, because I think that there's always a need to challenge the status quo, bring a little rock and roll into kind of what is the accepted wisdom in health information, or really just information in general. So I actually see the future just being this constant kind of healthy tension between both, and making sure that kind of both sides are checking the other.
Yeah, I'd agree with that. And I also think that, I think about my roommate and me. So, we went to grad school. We know how to use the internet. We kind of, have health literacy sort of baseline based on our training. And we are able to sort through what should I trust, what shouldn't I trust. And I do think we need to reinforce trust in institutions and follow the recommendations. I also think that the reality is that there's a large proportion of the population where that's not the way they access information. And sort of credible messengers is the key, right? So, in public health, there's actually interesting models in violence prevention that are based on epidemiology of public health. Credible messengers are really important. And so the wisdom of the crowd, to me, represents credible messengers. So who are the right people to share that message? And I don't just mean, I think who you put in front of the screen, I got to relate to you. But I think it goes beyond that as well. And I think we have more platforms where people that you can relate to can share their experiences. And so I do think that will be probably the more dominant force if we can build trust in institutions and spreading the messages in the right and most effective ways.
Yeah, I guess one way that I framed this in my mind, we were talking about this earlier, is you have a large group of folks that do still believe in the WHO and CDC and kind of check those websites and trust what they say. You have a large group that effectively doesn't believe them at all and kind of believes their lived experience. My uncle had it. It wasn't that bad. I think that they're making it up. And these two groups often don't speak to one another, and we know this, especially in this country. And it's fairly unique in this country. I think many other countries are not quite as polarized as ours happens to be. And I think one of the things that we need to do is figure out how to penetrate and get those two sides talking to one another. To your point, organically, there are new learnings. People discover new things, and I think sometimes scientific communities need to be more open-minded and frankly humble about saying, that makes sense. Let's learn a little bit more about, maybe it's intermittent fasting or whatever it is. That's kind of the vogue thing. And let's experiment and get the data on that. And on the flip side, I think it's important for those communities to kind of start refostering that trust. I mean, it's corroded over decades, not years. And I think it'll take probably decades to build it up again. But I think it's very necessary.
So we've talked a lot about the misinformation among the general public. And obviously there's, each of you are at companies that have employees as a key stakeholder. And in order to flatten the curve among the employee population, not only do you have to convey the right information to them, and also in a credible way, but some companies are deciding not to open offices, or they're mandating vaccines. Do you mind talking a bit about organizationally what you're seeing, and how do we get employees on board with regards to flattening the curve as well?
I'll jump in. I mean, one of the big things that we're noticing, I think, industry-wide is the great resignation. A lot of employees are looking for new jobs, are looking for sometimes no job, and saying, let's just stay at home for a while and try to figure out what I want in my life. COVID has made people rethink what they want, how they prioritize their day. And I think that in terms of companies, one thing that at Osmosis we've had to kind of really grapple with is the waterfall effects of COVID-19, including mental health, the need for personal time, the need to sometimes take care of family. We're seeing that with really, even here at ASU+GSV, a lot of folks didn't show up because they have family that they're thinking of and caring for. And so these are new considerations, and work-life balance has never been as blurred as it is today, especially with people not working in office settings, and maybe we'll never go back to that office setting kind of life. And so I think just really rethinking what's necessary and making sure that work fits into a person's life versus the other way around, I think is the biggest shift that has happened and probably will be here to stay.
I think to add on to that too, it's even redefining mental health and like what that actually looks like and means for employees. And even going back to what you were saying, Shiv, earlier, it's really this another kind of opposing force where humans just want clear guidance, right? We want a clear story, we want a clear narrative. You can come back on this date, everything's good. But the reality of our situation is that it's actually really ever changing and not clear. So I think all of us, whether you're an employee, whether you're just a human living in this time, has had to really get used to this ambiguity that we all are now living in, and this unknown of what is work going to look like. And it's been really interesting.
And I'll add one more thing, which is I have grown a strong appreciation for our leadership, especially Dr. Rob, our Chief Medical Officer, and he sends these weekly updates on the data, right? And not only is it the data, because it's overwhelming, he provides his narrative on what he thinks is going on, but also the things that he's questioning, and we also share the stories that our patients and our families are going through, because then we can relate to like, everybody is experiencing this and we're all struggling through it. But by also seeing the stories and what's working and not working with the patients that we serve as a company, that really gets the whole company thinking about what else could we do better if this is what we're seeing in the field. And I think people naturally take that and translate it to their own lives. We've put on webinars and things like that I'm pretty sure our staff then takes to their families, their communities, and their homes and shares the knowledge that way. So I think it's really, really nice to be able to have leadership that are vulnerable with, here's what we know, here's what we don't know, here's what I think is happening, and just being open with that. That level of conversation then invites other conversations like on mental health. Not everybody wants to talk about it at work, but when you open that vulnerability up, I do think that people are more receptive, and now is the time where people want to talk about this stuff. So those gestures may be gestures, but they mean a lot, and they could lead to cool things.
And that's a really great point. And having clear communication, and then I love the 4R framework that you mentioned, Ariel, earlier, about ways to, obviously, the way YouTube is combating misinformation. Now I'm curious, going back to the question I asked about, the false dichotomy I posed of, do we go all crowdsourced like Wikipedia or YouTube to some extent, where there's all these channels, anybody can make a channel and put it up, or do we go just trust in your Dr. Fauci, your CDC, your WHO, Surgeon General Vivek Murthy? It's a false dichotomy because obviously there's a lot of people in between that. There's regional leaders. I mean, you work with school nurses, like a lot of them are using Hazel Health in telemedicine setting. You obviously have curated a bunch of channels, and some of these are big, some of these are small. There's teachers, coaches, all sorts of micro-influencers, maybe even Instagram influencers too, like on a local scale. Can you talk a bit about, how you think, who are the sources of authority that I think we should be going after that aren't talked about enough? For example, like Rishi, you and I were talking about church leaders, right? So some people, especially in the Bible Belt, there's a lot of misinformation and people not getting vaccinations. Maybe their church leaders are the ones, not Tom Brady getting a vaccination, but your local pastor, as an example. So can you comment a bit about how you reach those sources of authority and who they are?
Go for it. Okay. So it's really interesting that you bring this up, because in terms of sources of authority, there's some really interesting research that came out that people are more likely to listen to their healthcare practitioners that look and feel like them, that are actually part of their communities. So one approach that we've taken at YouTube is, yes, we're partnering, with the CDCs and the typical folks that you would think of in the health space, but we're also working with like the Kaiser Family Foundation and some of these smaller, more grassroots organizations where they can bring doctors who look and feel like the audiences that they actually want to disseminate information to, and curate conversations that then we can help get in front of the right people. So I would say in terms of sources of authority, it is obviously very dependent on the audience that you're trying to reach. But I think using data to help inform what's actually happening on the ground and how are people, responding and listening to those people in their community is important.
Yeah, I feel that like being an MD, even though I don't practice clinically, people look to me for advice, right? So you have to be very cautious what you say, and you have a lot of credibility. And with pediatrics, parents really look to pediatricians for what to do. I'm an immigrant, and like my parents, navigate healthcare very differently than I do. They don't ask questions; they follow directions, and not everybody does that. I will also say that we don't always get to pick the authority for people. I also learned this from my prior role doing cancer work and sort of cancer work in mental health. Sometimes people don't want to hear it from a professional, somebody who is wearing a white coat or somebody who has been trained academically in an institution, because you don't sound like me, you don't talk like me. Probably the best COVID video I saw recently, I sent to my company, was Marshawn Lynch having a conversation with Dr. Fauci, right? And he asked questions in a way and he posed questions in a way, and this is all through YouTube, in a way that was like, I took in what you said, but I didn't understand a word of it. So let's talk about how it actually pose these questions and also address the underlying issues here about equity that are also here that we have to address, right? So I think sometimes those authority figures bubble up themselves and want to have a platform, and we have to figure out who's the right people to do that. And then sometimes the community, like you said, they will tell you, who we want to listen to. And you're right, there are pastors and people like that are pretty anchor parts of communities, and so definitely should be turning to them as well.
I love that concept of the authority figures constantly change. So we've actually kind of taken that concept to heart in the sense that we work with a subset of creators. So literally farm tubers, there's a large community of farmers that have YouTube channels. They're great. They can teach you how to sustainably farm. But at the same time, we've partnered them with rural health experts from Harvard and actually had them sit down and eat and talk the same conversation that they have with someone who actually understands what it's like to live on a farm and the different health challenges that they face. We've also done really interesting collaborations with the designer Dapper Dan and Vogue, and having him sit down with Mary Bassett from the Harvard School of Public Health and actually dig into understanding why the Black community is more hesitant towards vaccines versus others. So to your point, I think the sources of authority are constantly changing, but it's important to pair them with the right people that are trustworthy and they can really break down those questions.
Yeah, not a whole lot to add. Just one other phrase that resonates with me personally, which is your tribe. I think people really resonate with who their tribe is. And the question really is is my tribe taking the vaccine? Because if so, I'll take it. And if not, then I'm out. And so that tribe definition could be ethnicity, it could be age. Oftentimes teenagers trust teenagers. It can be dependent. And I think increasingly it's also not going to be the traditional tribe definition. So it's not always going to be race and ethnicity and gender. It's going to be activity-based. I trust what my rock climbing community does. I trust what that's my source of information. And so I think more and more we're going to have to sort of penetrate different sort of tribe memberships and say hey, this is the person to be executing the message. Because frankly, the message is sometimes less important than the messenger.
That's interesting that you mentioned maybe doubling down and finding the social groups and the tribes, because the counter argument to that is maybe become less tribal, right? We're all actually humans, we all have lungs, and we all suffer from COVID and can die from COVID. So maybe, instead of doubling down on tribalism, maybe becoming doing as much as we can to end tribalism and reunite in our shared humanity, right? What do you think of that?
Yeah, it's an interesting point. I mean, I guess I kind of harken back to the idea that human beings have been around for tens of thousands of years, and I think at some level we're sort of used to having 50 to 150 connections, and probably that's where we max out. And I think beyond that, it's sort of some superficial sort of connection, which can be useful in professional settings and other places. But on the deep sort of visceral level of, am I going to vaccinate myself, or am I going to take this medication or whatever, I think we do kind of harken back to that smaller group and trust that smaller group really deeply. And for kids, oftentimes that's your family unit. But as you get into teenagers and beyond, you sort of redefine who that group is for yourself.
If I could add one thing, I do think tribe is important, because the value of the tribe is the depth with which you're willing to go in your logic or your reason, right? Why I don't want to get the COVID vaccine. I don't know you all, and what I would tell you about my reasons why would be very different than if I had my tribe here who would listen to a conversation and allow me to go there, right? Allow me to talk about all the insecurities I might have. So I think the power of the tribe there is that like it does bring that out of people, and when you let people have that conversation first, then you can get to the logic and reinforcement of what the science says. Then you can maybe think about, motivational interviewing, changing behaviors. But that security is really important for people to even get in that mindset of, hey, maybe I'll think about this a little differently.
That's really, really fascinating. I mean, continuing on this topic, I mean, what's one theme that we've seen even before COVID, and something the Surgeon General, Vivek Murthy, was talking about the first time he was Surgeon General, then he came back under the Biden administration again. And in the intervening time, he wrote a book on loneliness and isolation. And we've lost our tribes, right? So even though what Rishi was referencing was this concept called the Dunbar number. You guys has anybody heard of this? It sounds like some people are shaking their head. It's very fascinating where basically they, as a quick aside, they did this anthropologist named Dunbar looked at all these different primates, and based on their cerebral cortical volume, how big their brain was, surface area too, he mapped out, okay, macaques live in groups of 30 macaques naturally. Chimpanzees live in groups of 50. I'm making these, I don't know the exact numbers. And based on that, extrapolating to human brain size, what would they, if we were living as primates do in the wild, what would our natural tribe be? And it's about 150, right? We can maintain 150 connections. So even if you have 10,000 LinkedIn followers or 50,000 TikTok followers, this is not your tribe. Like you can reach as many people, but it's not like 150 people you know. But back to isolation, is this something you think has contributed to all these conspiracy theories, that people don't have tribes anymore? They don't trust, they're aging alone, they're living alone, they don't have communities, they've lost religion, like these kind of things? Or is this why we're seeing all this misinformation pop up in conspiracy theories, or?
It's an interesting question. I mean, maybe. I don't know if we have the data to prove otherwise, but I think on this idea of tribes, I also think that's why places like YouTube become so important to people's lives. Like people's creators that they follow, they feel like they are a part of their tribe. And I think that's also why social media and influencers have become so relevant and important in the fabric of people's lives, especially today more than ever, because people are lonely and want to feel that sense of belonging. So influencers and creators make you feel like you are a part of their tribe. So I don't know if I'm really answering your original question, to be honest, but I would say the sense of tribe probably only gets heightened when people are feeling more lonely.
Yeah, and I think it's clear to everyone that we have more geographic loneliness than ever before. I mean, you wake up in a place, you hop in your car, you go to work, oh, that's gone now, so now you just stay in your place. And then you spend your day there, and then maybe on a weekend you go out. And so a lot of people don't know their neighbors or their neighborhood. And so you still have that strong sense of need for belonging. So where do you get that? Well, you get it online. So where specifically you get it from, the folks that you follow. And so I think that makes total sense.
And I think it even goes back to, like, yes, there could be a negative side to that, but I also think there's so much positive to that as well, not just from making people feel like they're belonging, but in the ways that even we've been working with creators, using their positive influence and using their tribe to get the right information out to people in ways that they want to be spoken to, versus just hearing the same ad over and over again, or hearing the same message in the same language over and over again.
And just a quick reminder, so we have 10 minutes, and I do want to make sure we have time for audience questions, as well as, again, we have the head of health partnerships at YouTube. We have two physicians on the stage, one half physician. I'm still on leave from med school, so I'll probably be useless here. But if you guys have questions, then start thinking about questions you may have for the panel, as well as some of those questions can just be literally, should my 2-year-old get vaccinated once that becomes available? So start thinking about that, and again, as an added incentive for asking questions, you'll get an Osmosis caffeine mug. But just 2 more questions for you all, and this is fascinating. On the topic of isolation and the fact that you run behavioral health efforts at Hazel Health, all of you can comment on mental health challenges and all the exacerbation we've seen in the last 18 months, as well as all the VC funding we're seeing now for mental health startups. BetterUp, the chief medical officer of Walmart Health just went up to BetterUp. Prince Harry is like the spokesperson for BetterUp. So there's a lot of excitement around mental health. as a service, but there's a lot of challenges. That's why these companies have emerged. So can you talk a bit about mental health challenges and how we can flatten the curve of anxiety, depression, and other things like that?
I could talk about this for months. Okay, so I'm so excited that people are finally paying attention to mental health, because the reality is that we've really just neglected mental health for decades. And it's not a passive neglect, it's an active neglect of not just like there's stigma around it, but we don't want to dedicate funding to it, right? And now we're at a turning point. Everybody's talking about mental health. So we have a load that we are, like, sort of a need that we were already coming into the situation with. For the pediatric population, we were already in a crisis. So if you looked at some of the numbers of especially like those families and children receiving public services, which is a large percentage of this country, something like 2 to 3% of them were actually getting the care they needed, those that did need help, right? So prior to COVID, we had this problem where people were not innovating and designing on mental health supports because it was not paid attention to. Now, with the influx of funding and innovation, everybody wants to solve mental health. It's a very complex system that we have built, and that's why it's hard to solve. So I'm really excited about interventions where you're able to provide timely access to care, differentiated solutions. So that's one thing in mental health that we have lacked. Not everybody needs to go see a therapist. Not everybody needs to be escalated to a psychiatrist. Basic psychoeducation and some pathway into the care journey is really important. So I think those tools are going to be very, very needed. But we cannot spend our time always just tackling the low-hanging fruit in mental health right now. And what I mean by that is, at this point, CBT, digital interventions like CBT, that's table stakes. The ability to track moods, the ability to report that data, that's table stakes. We have a chance here to redesign the system and the infrastructure. That means from the health plan side of things, how do we better reinforce and incentivize providers to be practicing in certain areas? From licensing, how do we encourage more workforce to be deployed in certain areas at different levels of care? So without these systemic changes, also learning, so I work at the intersection of healthcare and schools. Everybody's looking at schools as a place to deliver healthcare. It's complicated. You're not going to be able to do it well on your first try, right? We're still learning. So there's these tremendous opportunities to invest. You know, it's not as sexy, but infrastructure, operations, systems, that is what's going to enable things like those apps that we always talk about to be the most successful that they can be. And I will say that the kids are really struggling. You know, we had 20% of this population before this was already dealing with diagnosable mental illness at young ages. Now, sometimes in our visits, we have over 50% of visits being related to mental health. And they're not just depression and anxiety. It's self-harm, it's self-cutting. You have young teenage girls and boys who've not left their bedrooms in November, for instance. They couldn't get out of bed because they were that severely depressed, right? And they've been on their own. I also want to encourage you all, if you're going to be in the mental health space at all, we're not going to get a perfect solution. Do not wait to invest or spend time in building the perfect thing. We cannot provide good long-term care in this country yet, you know, for the majority of people. We need to start somewhere. We need to start with whatever approaches we can so that people can start having these good experiences with mental health so they want more. And we need to teach each other what works and what doesn't work. And we need to be quick with, if it doesn't work, let's move on from it. Let's not focus on the shiny object where we're, you know, applying all this new technology to do it. Let's just do the simple things right. So I don't know if I veered a little off course, but I could talk about mental health for days. Happy to talk about it afterwards too.
Be careful, I can talk about it for months. Okay, so when we think about mental health in the context of what we do at YouTube Health specifically, we have two key goals. One is how are we increasing access to resources for our users? And then how are we destigmatizing mental health and actually normalizing the conversation using our amazing creator base? So I'll talk about the first one first, which is around how are we increasing access to resources. So if you actually go onto YouTube today and you type in something like anxiety, depression, suicide, we have amazing partnerships with organizations like Crisis Text Line, Suicide Hotline, and have enabled in the actual product simple click to text, click to call resources that are right there when we get signals that users may be looking for something like that. And then on the flip side, around how are we destigmatizing the idea of mental health, we are really thinking outside of the box here and working with partners and creators. One example in particular is we did an amazing series with Kendall Jenner on the Vogue channel where she was really open and honest about her struggles with anxiety. And our team was able to find amazing mental health experts from NAMI to Lori Gottlieb, who's a pretty famous author, and make sure that there's experts in the room to give practical tips and really drive the conversation to make it fruitful, not just about sharing experiences. We also have a lot of really great partnerships with organizations like NAMI and helping them use YouTube better, right? How can they get really smart and think of themselves like creators so then they can help users who are looking for, questions like what is anxiety? What's a panic attack? What does a panic attack feel like? So users are getting the right information, but in more accessible and interesting ways than just maybe reading an article.
Yeah, I'll just say a few words. Obviously, you both are huge titans in this space. In terms of mental health, we've created mental health resources. We've done our bit. I think there are some vulnerable populations that are worth noting, specifically around substance use, homelessness, and groups like that, where mental health is so closely tied to the issues there. And what we've tried to do is create really powerful and scientific content in that space. So it tries to kind of remove the framework of morals and right and wrong and all that kind of stuff, and just and focus on the science and what we know about those topics. So that's our kind of, I would say, small contribution to the space. I think what you said makes a lot of sense.
Awesome. And with that, we have 3.5 minutes left. I would like to open up the floor for questions you have, and maybe any misinformation you may have heard or want to get corrected. Yeah. And feel free to say your name, please, as well. Mike, we can project, hopefully.
Thank you. My name is Brian Massey. My question, when having these conversations, whether it's with a group of students or employees about misinformation or health literacy in some cases, what are some practices that people at this conference can remember to keep in mind when they have those conversations to make sure it's an open discussion and one that people are receptive to? And then following that, after the discussion, what are the things you do in the weeks and months to check in and see, did it go well, did the message land, was I being equitable and thoughtful?
Yeah, I think to answer your first question, which is how do you go about having these types of conversations, I think it also goes, the first question would be who's your audience and who actually resonates with your audience, and then who can you partner with to actually break it down for that specific audience and who they actually want to be spoken to. Even the conversation that you mentioned that happened on YouTube, with the basketball players, or even understanding like who do these people actually want to hear from, and then how can you break it down for them in a message that makes sense. And then to your second question around, well, how do you know if it worked, or how do you continue the conversation? Like at YouTube, we think about it as literally asking your audience, like telling them to comment down below, continuing the conversation, and don't make it a one-stop shop. And actually, there is no end. Just like healing, it's never linear. It's constantly going in and out. So it's a never-ending journey, I would say.
One experience that we had at Osmosis that was quite powerful is we had our team of, at the time, let's say about 40, 50 people on a call, and it was at kind of a really critical moment. Black Lives Matter protests were raging through the country. We had COVID-19, anxiety, unemployment issues, people dealing with partners that had been unemployed, and then of course the backdrop of anxiety and depression and things like that. And so amongst this sort of milieu of feelings, we had everyone sit around and really sort of like almost very, very basic, we sort of passed the conch around, allowed people to speak their mind, and said, just say what you want to say, maybe have a short story to tell. And the powerful thing is that we at our company, and many companies, we care about each other. We are each other's tribe mates. And so everyone listens, and it becomes very poignant. And I remember that meeting. I remember, that day. It was a very powerful day for us as a team. And it was very egalitarian. Everyone had a chance to speak. It was very voluntary. And I think everyone walked away with just this amazing kind of feeling of maybe nothing has actually factually, objectively changed, but we're all in this together. And you can kind of feel that I'm anxious, but so are you. And somehow that makes me a little less anxious. And so I think that was a powerful thing for our company.
Mike, with the final word.
Well, I'll just say I have a mentor that really valued the idea of you can't fix people. and she came from the field of domestic abuse and trauma. They know they got to get out, but they haven't been able to make those choices, and it's not because they don't want to. So equipping them with as much information, Brian, if you have follow-up checkpoints, come back to it, take notes on it, ask them where they are in that journey, keep giving them resources, and just keep being there. I mean, that's my short answer. But you can't fix people if they don't want to, take what you're giving them at this moment in time.
I'd like to thank our panelists for the great conversation. Brian, thank you for the question. You can come up for the mug, so I won't throw it at you. And give them a round of applause, please.